Okay, everybody, I have right at 6 o'clock, and I have that the numbers have slowed down just a little bit. So we will give it just a second and we will get started. This is our March EVV Town Hall. My name is Brian Dowd. I'm the Deputy Executive Director over Policy, Operations, and Policy and Operations. I'm sorry. I've also been the EVV business owner for about 3 or 4 years now. So I'm very happy that you all have joined us tonight. I know it's 6 o'clock on a Thursday. We like to do these in the evening so that if people have any kind of conflict, that they're able to do it in the evening as well as in the day. We probably will not have, we'll probably have monthly town halls. Next month, we are likely to do a participant-directed town hall because we've gotten asked that a couple of times in the last presentation and gotten an email if we could just do another touch base to hear from the participant direction community. So we will be doing that next time. Of course, if you are a participant directed member, you are welcome to stay along. This will be targeted a little more to traditional providers today, but as always, all the information can be shared and I think it's valuable to keep informed. So don't feel like you have to drop off by any means. Also, the other thing I want to say, because we got asked this again last night, was will these slides be available? Yes, the slides will be available. Every single town hall we have done is on our EVV website, along with a recording for every single town hall. So you can absolutely positively go to the town hall and see it, and you will be able, go to the website and you will be able to see it. The way you can get to it is simply by Googling EVV DCH. It'll be one of the first options that come up in any search engine, Google or any other. So again, thank you for joining us. It probably won't be the whole hour. The presentation is not that long, and we will hopefully get to some questions here at the end. We start every mission at the Georgia Department of Community Health with the agency's mission statement, which is to provide Georgians with access to affordable, quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do some operations updates. We're going to talk about common issues and frequently asked questions in operations. We're going to give a little update of HHCS, which is Home Health Care Services, and that's the phase 2 of EVV implementation. I'm going to give you an update on our third-party EVV vendors, and this is a very important update. We're going to give you the information on contacting the call center, and then do a question and answer period, as I previously stated. So let's start with the EVV operations updates. Big news is that we gained certification with the Centers for Medicare and Medicaid Services. That's who CMS is. They provide the majority of the money from federal tax dollars for the Medicaid program, including Georgia. 2/3 of the money for Medicaid and claims goes from the federal government, and they're kind of like the big boss in this. So on February 9th, we became one of the very first states in all of the United States to be certified for EVV with an approval. We believe we are the first state to be certified, gathering key performance indicators based on outcome measures. There is what we believe to be less than 5 states in all that are certified at this point. So certification just helps us with funding for the EVV program. It also helps us to track outcomes with the federal government, because the federal government is our partner in key performance indicators and evaluation criteria. So it sets up a relationship where they are also looking at our EVV metrics and making sure that we're operating well according to the Cures Act, the federal requirements. So I wanted to provide y'all with some key statistics, because I know sometimes it's hard what's the old saying, to see the forest from the trees. And I know, and I am very guilty of this myself. I get very caught up in my problem that I'm having at the moment and not looking at kind of the whole system. So we certainly acknowledge that there are some things within EVV that we are continuing to try and correct, and other things that we're trying to enhance. So yes, we're certified, but the federal government knows that we still have some operations issues, and we'll talk about that in just a minute. But it's important to note that 86% of all PSS and CLS claims, personal support service and community living support claims, in December were correctly submitted through EVV. So 86% of the universe of claims impacted by EVV were appropriately going through EVV. So that is a huge accomplishment. We've had over 2 million completed visits of EVV captured, and we have over 1 million submitted claims successfully for both personal support services and community living support, including one provider who has submitted well over 50,000 claims, closer to 100,000 at this point. So what's our timeline? Many of you know that April 1st, the system actually became operational. November 1st, we required via policy that you use EVV for PSS and CLS claims unless you had a valid exception. January 1st, for 2 weeks, we put on a mandatory claims edit, and then we switched that mandatory claims edit to a pay and report edit. So if you bill directly to GAMUS for one of the reasons that we allow, now there's only one, and we'll talk about that in a minute, but if you bill directly to GAMUS, it kicks off on a report. It pays, it doesn't deny your claim. It gives you an edit letting you know, hey, we recognize that you're billing directly to GAMUS and not to EVV. But if you look to the left of that edit, you will see a P for paid. That then kicks out to a report. And I have staff that are auditing that report. They look at every single provider, make sure there is an active tier 2 ticket or another valid reason, and they are contacting those providers every single day to ensure that they are aware of EVV and that their reasons for billing directly to GAMUS are valid. As you saw from the data, 14% of the people are not billing their claims through EVV. And our ultimate goal and requirement from the federal government is that we get to 100% of claims submitted through EVV. So what's the current billing exception? As you will remember, we previously had two. One was that patient liability or cost share was not working correctly. That has been corrected. As of the beginning of this month, actually in February, that was corrected. So you should be billing your patient liability and cost shares through EVV now, your clients that have that. If you have CCSP members that have a cost share, they should be billed through EVV. There is no longer an exception. If you haven't been doing that, don't worry about it. Do it now. Do it now before my staff starts to call you and ask why you're continuing to bill cost share clients directly to GAMUS. You can say, oh, I heard Brian on the town hall and we started this week to use EVV. The valid reason for billing directly to GAMUS is that you have an open tier 2 ticket. You have called the call center. The call center was not able to resolve your issue for using EVV, and they issued you a ticket number. It's usually like 1, 2, 3, 4, 5. If you have one of those ticket numbers, as long as you have that ticket number and no one has called you to say that ticket number is resolved and closed, you may bill directly to GAMUS and not through EVV for all of the members associated with that ticket. Now, if you have some people that are in your system and they're working correctly, you need to be billing EVV through that. The ticket is just for those members in which you have an issue. And 99% of the problems we're hearing right now are missing clients or PAs not updated. It's 99% of the issues we're hearing, and we'll talk about that a little later in the presentation. Okay, so let's go over some common issues and frequently asked questions. Rounding rules. I'm still getting some questions about rounding rules. And the easiest way to think of rounding is 8 minutes or more will round up in a 15-minute unit. Under 8 minutes rounds down. For a half an hour, 30 minutes or more rounds up to a full hour. Less than 30 minutes rounds down. Most of our services are done in 15 minutes. So the rule here is if it goes to 8 minutes, it's going to go to another 15-minute unit. So let's give you some examples. Aid 1 clocks in at 12:58 for a 1 p.m. shift and clocks out at 3:10. So that's a total of 2 hours and 12 minutes. So they're going to get 9 units billed, 9 15-minute units, because 12 is more than 8. Aid 2 clocks in at 12:58 for a 1 p.m. shift and clocks out at 3:05. This is only going to be 8 units or 2 hours, because 2 hours and 7 minutes, 7 is less than 8. So it goes down. We've had a lot of folks tell me that they have gone in historically and just shortened the time for their providers, and they only pay their staff what is on the schedule. And we have to pay for time that was actually serving the member. So it's really important that you have conversations not only with your staff, but with the members you serve to say, hey, if my staff member is going over 15 minutes here, 15 minutes tomorrow, 15 minutes the next day, 15 minutes on Thursday, by the time you get to Friday, you may have an hour less in units than you thought you did, because that staff member was staying 15 minutes late every single day. Now, if you see that you don't have enough units and you're consistently needing the extra time, that may be a conversation that you and your member needs to have with case management, because your plan of care should correctly reflect the number of hours needed to provide services in the community. So billing related issues. We are seeing a lot of staff members who they're not very savvy at understanding how billing works in GAMIS. Nothing has changed about GAMIS billing. So you need to have a fairly good understanding of how your remittance advice works, what claims edits are, when something is adjusted to paid or partially paid, what that means, what your pay schedule is. If you don't have a good understanding of that, please write me an email and ask for some help. We will deploy a field program specialist for GAMIS who will sit down with you and go through all of these things. They'll go through your remittance advice. They'll teach you how to look at edits and audits in the system to ensure that you can bill correctly. We've also continued to hear from some providers that the GPS is off on their phone. Their workers are sitting there with the client and hear the client on the phone and they're in the house, but when they clock in, it says they're 10 miles away. Sometimes we have seen that the calibration on people's phones is messed up. And our call center with EVV can help you recalibrate that phone. So if you consistently see a staff member where that's happening, please have them call the call center so they can get that corrected. Okay, the big one that we continue to get into the call center and into the EVV mailbox way more than anything else is missing members and missing prior authorizations. So we get asked a lot, how can I just add a member? How can I just add a PA? And can EVV just add them to the system? And the answer to that is no. EVV does not add members, nor does it add prior authorizations to their system. They get that information directly from GAMIS. So your case manager has to update the PA for you, whether it's a new member or a changed member or a changed number of units. That has to go across to GAMIS. That usually takes 2 to 3 business days. And then from GAMIS, it goes to EVV, which takes 2 to 3 business days. So sometimes y'all are writing us on the same day that case management has made the change, and case management hasn't even put the change in the system yet. You've heard about it and they've contacted you, but it hasn't made its way to GAMIS. Sometimes you guys are contacting us the same day it goes to GAMIS. And we're having to tell you, just give it a couple of days. We'll get it in probably 3 days from the day it goes into GAMIS. Other times you guys are contacting us and saying, hey, this member doesn't have, I see a PA in the system, but it's not an EVV. And when we're going in and checking, the member only has QMB or the member only has SlimB, which is qualified Medicare beneficiary or specified low-income Medicare beneficiary. And those are not the right types of Medicaid to receive waivered services. And as such, they don't pass over to EVV until their PMAO or full Medicaid case is activated. They've got to be out there in one of the waiver categories of assistance, SSI, or something like Katie Beckett, in order to get the full Medicaid eligibility. And they will never show up in EVV until DFACS makes them active for the appropriate aid category. Now, there are other times where we have discovered other things around this, like specialty codes aren't right. There's an extra character in the name. Those things we are working on by a one-on-one basis, and we are trying to correct and institute audits to make sure that it happens automatically in the future and you guys don't continue to have missing members and missing PAs. But we are working on those things. This is by far, missing members and missing PAs, our biggest issue. It's pretty much 95% of what I hear from providers at this point. Claim submission deadline, again, please make sure all of your claims for the week are in by tonight at midnight. Thursday at midnight, the claim file goes from EVV to GAMUS for payment. Also, we have heard a lot of questions about the rate increase, the 10% rate increase for EDWP and ICWP. That is now in EVV, and we are working to do a mass adjustment. We hope to have that here released shortly. It is in draft right now that goes back to July 1st. There was a recent increase for the now and comp waivers that was just approved this week for now and comp for a 5% rate increase across the board for providers. DBHDD is working on updating the PAs for that, and we have a change order for CLS to correct the EVV system as well. So as a reminder, if you don't know how to view your remittance advice, please let me know so I can get you help with that. If you don't know how to do your claim status, voiding, adjusting, look at your service units or prior authorizations in GAMUS, please contact me to get help for you out to do that. Or you can contact GAMUS directly here via their website and ask any questions or ask for a field program specialist to contact you. Okay, let's talk about home healthcare service implementation. This is phase 2. Home healthcare is coming in the second part of EVV. It is just specific to category of service 200, which is home health. So we are working now to contact those providers. It's a pretty limited pool of a couple of hundred providers that provide very specific services. They're skilled nursing in the home to help treat a wound, occupational speech therapy, not the therapy in clinics for children, but the therapy that is associated with home health. So those services are mandatory by January 1st, 2023, and we are already working with our CMOs to implement that as well. Just like in phase 1, we will have a registration period, a training period, a soft launch for home health providers to get used to using the system, and then a go live on January 1st, 2023. We will be doing all the same notification methods via the website, via banner messages, via blast emails, via Twitter, via Facebook, via our website to keep everybody informed as best we can. Third-party updates. So we are closing the door on the third parties, new third parties, and I'll show you why in a minute. We got quite a few third parties. You can continue to use any of the 35, I think it's 35 third parties if you choose to use them, or you can use the state-sponsored NetSmart system for free. But any new third party that would like to integrate with our EVV system, not new provider, but new third-party EVV system that you can choose to purchase to use for your service, they will need to initiate by the end of March in order to integrate with the state-sponsored solution. The deadline to fully complete integration is the end of June 30th, 2022. After that, we will be closing the door on new third-party EVV systems. And let me show you the number of third-party systems you currently have to choose from. So the NetSmart system is our system, the free system the state offers, but there are actually 34 other choices for you to choose from. Everybody from WebAuthor to AlayaCare USA. All of these on the screen, you can choose if you don't want to use the free NetSmart system. So there may be a few more that join us between now and the end of June, but at the end of June, we are not going to be doing any more integrations. You will have to pick from this pool in order to provide EVV. Okay, I get a lot of questions that come directly to me, and we want to make sure that you have the contact information for the call center. It is here on this slide, and it will be available on our website, 833-701-0012. Make sure when you call that you have your agency name, your agency ID, your NPI number, your EIN number, contact email, callback number. Make sure that you've looked on GAMUS to see that there is an updated PA and member, and that the member has the appropriate category of eligibility if you have a missing member. If you need training, if you need support, please contact the call center through any of these means. All right, I'm going to stop here now. I know there were a few questions, so I'm going to go through that. The question I have is talking about a really great question about manual timesheets. And do you have to continue to do manual timesheets? So let me say this. You do not have to recapture any information that is already captured in EVV. So if your clients are signing, if your aide is signing, or the clients may be acknowledging visits too, which is perfectly fine. Or if your aide is signing, if you're capturing the tasks, if you have sign in and sign out, none of that needs to be recaptured. If you do need to manually capture supervisor oversight, there is no place in EVV to do that. So you likely will need to print out your information so that that supervisory signature can be captured and documented. But if it's already captured in EVV, you do not have to recapture that information. HFRD OIG has access to the EVV system to view the information on EVV. They have their own access. We don't sign them in under us. They could routinely go and look and see what's going on with EVV. So does the Medicaid Fraud Control Unit and CMS. Okay, that's the only question I have right now. It looks like somebody else started to ask me a question. So I'm going to give it just a second to see if anybody else has any other question before we sign off for the night. So I'm going to give it just a minute, and I'm going to remind folks that you can always write an email question into the EVV mailbox, which is our EVV mailbox, or you can contact me directly, Shirley, if you need to. That is fine as well. My email address is my first initial and my last name. It's bdowd@dch.ga.gov. So I'll put that in the chat right now. So you have it. That's my direct email. Oh, here's the other question that came in. Where is the best place to find the correct diagnosis codes that may not be flowing over correctly? That question is, so we don't do any unspecified codes in the state of Georgia. So there should be an ICD-10 listing that has correct diagnoses. Let me give you a real quick example. Like broken finger, we wouldn't do. We want to know which of the fingers is broken, which of course isn't a validating condition to be in a home and community-based waiver. But anything that's unspecified, we can't use. There is very frequently a code that your case management entity has that masks over to what is the correct diagnosis code. So you should be contacting case management to make sure that you have the right one. What happens to those unable to clock in but did the service? So you can go on the administrative portal and put in any missed visit. You just have to enter a clock in, clock out time and a reason code. I hear some of you all are getting an echo. I apologize for that. This will be recorded and posted on the website, so you should be able to listen to it at your leisure. Okay, any more questions? Please put them in the chat if you have any more questions. Who generates PA for new members? New member PAs are generated from case manager into the authorization system, whether that be WellSky for CCSP, Beacon for Now or Comp, or Alliant for ICWP or Source. Again, the solution for missing PAs or member would be to contact the call center. They will research that and do their best to make sure it does not happen in the future and get to the reason why. Next question is, why would one employee need to be verified when clocked in but not another? There's a federal mandate over what employees need to be clocked in, and all employees in CLS and PSS must, according to the 21st Century Cures Act, be accounted for through EVV. So all those employees must be accounted for clock in and clock out. Other services weren't part of the mandate, and that's a federal thing, not a state of Georgia thing. PA for each transaction is required. It's just a requirement of billing. It's just part of being a provider for Medicaid. If your aides are having offline modes, you probably need to discuss that with your aides and see why they're continually going offline. It may be a connectivity issue, or it may be something with their phone, or they may be choosing to go offline. If you are using a third-party system that is not integrated with us, you absolutely need to have a conversation with them to ensure that they are going to be connected before the end of June, or we will not be using them. So guys, some of you are saying, hey, it's taken the call center a long time to get the members in. Until the members are corrected, continue to bill through GAMUS. You're not losing anything, you're getting paid. Continue to bill through GAMUS. You just need to make sure you have a tier ticket. All right, I don't see any other questions that are new. If you don't feel like you got your question answered, yes, you should be billing ICWP on GAMUS. There were a couple of questions that just came in. Guys, I'm really gonna beg here for a minute. Go on the EVV website and educate, take time to educate what it is required by EVV and not required by EVV. This is a federal mandate. You will be audited against this for compliance. We have been up and running since April of last year, and I'm continually getting providers that are just now complying. And I gotta be honest with you, that's not acceptable. It is not acceptable or professional or the type of providers that we want in our provider pool. We have been communicating for 3 years on this program. So if there are legitimate issues around your members getting in the system, please call the contact center, call center, so we can get those EVV issues notated. We can do our research, we can follow up, we can contact you back. If it's not your fault, you don't need to worry about it. If you have an open ticket, that's not your fault, and you continue to bill through GAMUS. But it is crucial that you keep up with our communications and requirements on EVV. It's really, really, really important that you do that. All right, I want to thank everybody for joining us today. I will put my direct email in again, and we will have some of my staff doing some further looking into some of the issues that you all are raising. So I want to thank you for joining us tonight, and I hope you have a lovely rest of your evening. Thank you.